Hi, everyone. We are back for our speaker series, and today we are going to be talking about raising children with disabilities. And we have an amazing speaker. Her name is Danielle Sullivan, and she's actually the host of the podcast Neurodiverging. And today she's going to be talking about raising children within the same household that may have autism or they have ADHD, and trying to kind of guide us on how to navigate that. Just invited her on, and she should be joining us any second. There you are.
Hello. How are you?
Good. I'm so excited to actually meet you face to face. I know that we've talked before, and to really talk about this topic, because it's not unusual for families to have this kind of situation where a child may be diagnosed with autism or an autism spectrum disorder, and then maybe ADHD, and how to really navigate that as parents, because it can get kind of tricky. Both of them have very complex needs. So I think a lot of people are still joining us. Rick Astley fan club, someone from a Rick Astley fan club is joining us. Wes has joined us. Hi, Wes. Thank you for joining us. Appreciate that. Today we are talking to Danielle Sullivan. She is the host of the podcast Neurodiverging, and she helps guide and support parents that are raising neurodivergent children, and also with adults. So I know I've benefited just briefly talking with her in our collaboration. So she's a wealth of knowledge. So Danielle, I'll just kind of like give you the floor, and people will join as we talk, and we'll just go back and kind of remind them of some of the points that we went over.
Yeah. Okay, you froze for a second. I think I got you now. Yeah, so I'm Danielle Sullivan. I'm an autistic advocate for other neurodivergent folks. So I'm an adult autistic, and then I have two children, an elder son who is 8, who is autistic, and then a daughter who is 6, who is ADHD combined type. And also I should say that my co-parent, my children's father, is ADHD, and my co-parent and I were both identified as adults. So our children were identified first as autistic ADHD, and then we kind of realized, oh, hey, we get a lot of these traits too, which I think happens a lot. I've heard from especially autistic people that them are identified after their kids are identified. So it does run in families. Sometimes there's family genetic factors that feed into that. Anyway, so we have done a lot of work around making, especially our home, a safe space for our kids to express who they are as autistic, ADHD, neurodivergent people. But sometimes you have challenges where the way one kid wants to express themselves not only conflicts, but can actively challenge and harm the other child with their other kind of neurodivergence. So so I'm kind of here to talk a little bit today about some of those conflicts and some of the ways that we've navigated those challenges in our own household with our specific kids. Help other parents and families in the same situations.
Awesome. Yeah. First of all, raising a child with a disability, I always describe it kind of like as parenting on steroids, because parenting is already difficult, but yes, when you add the additional layers, and I'll be honest with you, I was not remotely prepared, and there's so much information out there. And then as you're trying to help your child, you realize, oh, well, 20, 30 years ago, I probably would have been identified as such as well, because you start seeing those traits in yourself. Obviously, a lot of them are genetic, and through treating my children, and I've noticed other parents as well, when they treat their children as adults, they finally get treated as well.
Exactly. Yeah. I think it's really common. I can't even count the number of, especially autistic women who seem to be diagnosed group as adult autistic women. There are more girls being diagnosed with autism now than there were when I was young. But there are tons of adult women out there who are autistic and don't know it. And a lot of times we then have children, and especially if you maybe have a boy child who is identified a little faster. Just a lot going on in the medical system and in the healthcare system that still lets girls slip through the cracks. And so especially folks around my age, 30s, 40s, 50s, did not have a great chance of being diagnosed if you were a milder autistic or somebody who didn't display a lot of the most kind of common stereotypical autistic traits, or if you masked really well, if you're just somebody who was really good at kind of faking at school or in public places and fell over when you got home. So then we become mothers and we have kids with autism, ADHD, other neurodivergent diagnoses, and to it. We're like learning about ourselves, we're learning about our kids, we're trying to figure out this parenting thing. It is like parenting on steroids. It's a lot to deal with all at once. Yeah.
Right. So your two children, you said the oldest is diagnosed with autism spectrum disorder. And then the other one is a combination where is it a he or she?
My daughter is the youngest. She's 6.
Okay. And she has the combination with the ADHD on top of that. So how does that look in your household on a daily basis?
Now it's a lot calmer than it used to be. My son is probably what would have used to have been called Asperger's, when you're kind of splitting up subtypes of autism. And so verbal, highly intelligent, very excitable and interested, but still has a lot of autistic traits, is not especially emotionally or socially aware, though it's obviously something that you can work on and improve quite a bit. A lot of the physical sort of stimming behaviors and the vocal stims, and also a lot of sensory processing challenges. So he can't touch certain kinds of metal. It totally is not worth the amount of effort for him to expend that. There's certain other kind of tactile issues he has, certain kinds of foods he can't handle the sensory feeling. And so a lot of kind of more stereotypical autistic traits. He doesn't like being surprised. He likes his routine. He doesn't like loud noises or unexpected anything, really. My daughter, who is combined type ADHD, and combined type just means that she displays some hyperactivity and that sort of traditional, often we see it with like the stereotypical little boy who has ADHD who bounces around and talks nonstop and just cannot sit. The hyperactivity form of ADHD. And then the other form is an issue with attention, being able to focus attention where you want it to go instead of where your brain just puts it. And so we call that inattentive, but it's not really inattentive. It's more that the attention doesn't go where we're aiming it. So she's both of those things. So she does what's called hyperfocusing a lot, which can also be an autistic trait, but it's when you are just so into your activity that the idea of changing tasks and doing something else is hugely challenging. She's very bouncy. She sings all the time. She does a lot of kind of calming stims like rocking. Stimming can be, it's kind of a wide neurodivergent trait. It's not just autism and autistic people who stim, but ADHD people do often too stim. So from her, we get much more the loudness, the bounciness, the physical movement. There's a lot of running, a lot of yelling. She also has the hallmarks of an ADHD trait called rejection sensitivity dysphoria. I don't know if you know that one. It's shortened to RSD, and it is basically the inclination to over-respond to emotional challenges. So if something happens unexpectedly and you can't help her right away, or she doesn't get the kind of specific support she's envisioning in her head, you can have a really strong negative emotional reaction to that.
Mm.
It was younger, looked a lot like autistic sensory meltdowns, but are totally different. They're more like panic attacks, where
Mm.
the fact that she can't enact what's in her brain panics her so much that she just, screams, cries, falls over, physically
Mm.
has this huge kind of reaction, which can be scary if you don't know what it is and how to manage. And also can like change and does not like loud noises and does not respond well to sudden, especially angry or aggressive kinds of sounds and feelings and movement. So there can be a lot of challenges with those two sets of traits sort of combined. Yeah.
So let me just like make it real, because Cuida is all about making things real. Because it's the everyday struggle. And that's really the whole purpose of why we do the lives, is because, like, we need to understand like everyday life. We need everyday life suggestions. I mean, there's parents right now driving in the car, and one child is autistic, the other one has ADHD, and she is, and I'm not even making this up because I've been in this situation myself, where, and I know you have too, right? Where the window up and down, up and down, up and down. And the other one's saying, stop it, stop it, stop it. And she's going up and down, up and down. Yeah. Like, how do you navigate those everyday life situations when both the kids really have very different needs, but yet similar? Or when you're at the store and you are spending hours trying to figure out, like, what are they going to eat? And, yet we're trying to feed them healthy. I mean, I remember my nephew, finally, he loved bananas. And literally, I think we bought all of the bananas in the store because we finally found something that he loved. So, like, how do you navigate those situations as a mom and yet keep your patience and understanding and not let them feel rejected or, affect their self-esteem? I mean, those are hard situations.
It can be really challenging, yeah. The first thing I'll just say is that if you are a parent and you have occupational therapy, occupational therapists are a gift to anybody who has a kid with ADHD or autism. They can help you, especially with food and diet issues, with sensory processing challenges, and also can help you figure out why your kid is doing a thing if you can't yourself narrow down, like, why are they stimming this way? What is it achieving for them? So I'll just throw that out. OT is fantastic, and check it out. And then kind of in terms of what you can do at home, it's taking each child as an individual and also remembering that behavior is communication. So whatever your child is doing, they are doing for a reason. If you don't understand the reason, then we might have to dig a little bit to figure out why. So a kid
I think Danielle might be having a little bit of technical difficulty. That's okay. I'm sure she'll be back on in no time. So today, Cuida continues our speaker series, talking to Danielle Sullivan about raising neurodivergent children. She has, her oldest is on the autism spectrum, and here she is. She's coming to join us again. And the other child has ADHD. And she is really kind of giving us some treasures, some jewels that she has learned along her way. So let's see if she's able to join back. sometimes when you go live, there might be some tech issues, but we just kind of roll with the punches and go with the flow. She's also the host of the podcast Neurodiverging, and it's an amazing podcast that really allows parents to feel like this is a safe space to kind of just be real and talk about the difficult things that no one really wants to talk about. It's like everyday life and trying to raise a child with a disability. And I love the point that she just made is that behavior is a form of communication. And we really have to ask ourselves, why? Why is my child stemming? Why is my child acting this way? What is my child trying to communicate with me? And there was this amazing study done, and I believe it was in Harvard, where they studied the behaviors of children with autism. And what they found was the majority of children actually had stomach issues, GI issues. And the way that they were expressing themselves was through these different behaviors. And they weren't acting out or they were trying to misbehave, but they were trying to communicate their pain. And so now as children are being with different disabilities are being studied, us parents are being given more tools to be able to add to our toolbox as to like, what can we do to help our kids on a daily basis? So let me see. Let me see if she is able to join. Again, I'm going to invite her again and see what's going on. So thank you, Katya, for joining us. We really appreciate it. Family of Choice Healthcare has joined us, Echo Box Memory. We really appreciate your support. Cuida does these speaker series. Every Tuesday, we talk about raising children with disabilities and giving tools and resources to our families, our users, as to what they can do to make their journey just a little bit easier. Let's see. So I think that she's having difficulty in joining. Seems like the live has kicked her off. Instagram has kicked her off. So, hi, Mr. Fit RN. Today we're talking to Danielle Sullivan, and she is a mom and also a podcaster on what it's like to raise children that are neurodivergent. Her oldest is on the autism spectrum disorder, and her youngest is on the autism spectrum disorder along with ADHD. And we were talking about what it's like, what's everyday life like in navigating that as a parent, and yet being able to fulfill their needs on a daily basis. So I think what we're going to do is our speaker was kicked off, and she's just sending me a message now. Hi, sorry for the troubles. It says I've requested, and let's see if that helps, if she can join back on. You know, this is what happens when you go live. There you
are! Hey, sorry, everybody. I don't know what was up with that, but thank you for your patience with me.
No worries. You know what? Like, I can just keep talking and talking and talking.
Oh,
so we just filled in the gaps.
I could see you the entire time. It just wouldn't let me join. So
no worries. No worries. You know, we're very flexible. So So you were talking about, we gave the example of you're driving down the road in the car and, you know, you have your ADHD child putting the window up and down, up and down, up and down. And then you have your child with autism getting really annoyed and telling them, stop it, or being at the grocery store and really trying to find something that everybody can eat. Because I know sometimes, you know, I feel I feel like I'm in a restaurant, like I'm cooking like 3 different meals for 3 different people, and it's a little bit of insanity. And I remember what my mother used to say, you know, you don't eat it, you go to bed hungry, you know.
Yeah.
And we just have a really different way of parenting now that, you know, we'll be in the kitchen making 3 different meals for one kid just to figure out what they'll eat. So it's really like navigating those everyday challenges. So I'll let you kind of talk more about that.
Yes. So there's a lot of work you can do before the situation becomes the thing in the car where the window's going up and down and down. So I was saying before that any kind of behavior you're seeing is communication. So it's about, as a parent, figuring out what your child is trying to communicate to you. Because children don't act out for no reason. They want to please you and want to be here with you. And so if you're getting a lot of kind of pushback, they really, really think that pushback is necessary, or they wouldn't be doing it. So taking your kid at their word, maybe not at their, you know, a 2-year-old isn't going to be able to explain exactly what is happening in their brain, but take their behavior as, you know, I'm trying to communicate this to you, and then be on the same team with them. So a lot of figuring out, well, if sounds tend to bother you, what can we do to mitigate that for you? Maybe we can, you know, invest in some headphones. Maybe we can invest in some sound defenders. You bring those with you. That's a go-to that is popular in our family. If you have a child who needs to stim and make the car window go up and down and up and down, ahead of time talking about, hey, some of these stims, we understand you need to stim. Stimming is normal. It's a good way to get your energy out. You can absolutely do that. But there are some stims that are okay and some stims that don't work. So let's find a list of some things that are okay, that don't bother other people, but that still allow you to get that need met. So we're still meeting the need of the child, but we're not bothering the brother with the noise. So you can get some of those little poppy, what are those called? Those little, they're so popular now. They're like silicone shaped, and you pop the little bubble in and out. Or you can get little fidget shakers that don't make a lot of noise but have a light. Or, you know, that there's alternative options. My partner carries around a Rubik's Cube because he just likes to fix with it, but it's not very loud. It's not very distracting. And so it's him to do what he needs to do, but not kind of overly bother other people. So a lot of it is, figure out what the behavior is doing and then replace it with something that works for everybody else. What was the other? Oh, you said about food. A lot of kids with autism or ADHD, there's multiple reasons they can have trouble with. One of them is sensory issues. So figuring out they don't like a crunchy thing, they don't like mushy things. Another thing is that they like crackers because all the crackers taste the same and look the same, but apples taste different from apple to apple. They look different apple to apple. So there's an issue with not knowing if this apple is going to be tasty or like the worst thing I ever put in my mouth, right? So learning how to support them with that, to try new things, but to not feel overwhelmed by it. And also to understand that from their perspective, the apple you're giving them today is not the same as the apple they ate yesterday, right? It's a different apple. I know that can be really frustrating as a parent. Like we're worried about, there's so many different things we're trying to balance in terms of like buying groceries and making sure everyone's fed and getting, but most kids should be getting enough to eat, even if they eat mostly the same thing day to day. And if they're not, then you go to an OT or a food specialist and help, build a diet. One thing that worked really well for my ADHDer who has trouble deciding what to eat because of some sensory issues and some other things, I'm sorry if you can hear my cat, is we actually made a visual schedule of foods that she could handle on a day-to-day basis. And that way, when she's fatigued, we can pull out the visual and say, on this, there's chicken nuggets, there's yogurt, there's cheese sticks, there's Cheerios, there's whatever that we agreed upon ahead of time. And when she's fatigued and she can't think of what to eat and she's overwhelmed and she's too tired and you just need to get something into her, she can just point. She doesn't even have to come up with words and get them out of her mouth. She can just point nuggets, and then I know, okay, I'll make these. So sometimes doing that prep work where, you're so that the thing doesn't happen in the car or in the grocery store afterwards, because you've already kind of done the work. So if you're noticing a recurring issue, like the car thing keeps happening, the next time you're home and calm and everyone's chill, like dig into it a little bit, talk to them, play with them, like, pretend together and figure out what they're trying to meet and how you could replace that. I know that was a long
No, this is so good. I mean, I hope you're coming on again, because you're such a wealth of information. And what I'm really hearing from you is parents have to be willing and open to educating themselves about, like, it matters what language you use. It matters your approach. And I think, like, as we were kids and we weren't understood, that was some of the frustration. And that was some of the frustration and hardship on the relationships within the family, is not getting your basic needs met. And, people may say, oh, children are seen but not heard, and all these different cliches 20, 30 years ago. Well, there was a consequence to raising our kids that way, right?
A lot of us just shut down and are 30-year-olds who don't know how to meet our needs now. So that's absolutely what we do not want for our children, I would say. Yeah.
Well, yeah. And then we get into relationships, or we start in the workforce, and we are really not able to navigate that. Like, there's a lack of emotional intelligence there. And that really needed to start early on, that kind of that training and intervention. I was talking to my friend, and, her little boy was diagnosed as being on the autism spectrum, having an autism spectrum disorder. And, then we start reflecting, wow, we could really see what intervention looks like early on. And as adults that didn't get that intervention, we could have avoided a lot of struggle.
A lot of therapy appointments, or a lot of, there's a lot of things I've learned as an adult just from raising my kids that if I'd known in middle school, in elementary school, I would have had a lot better time in my early 20s when I was first independently and first, like, responsible for paying bills and getting work and making meals and organizing all of that. I didn't have the skills, and I fell over pretty hard, and it's taken me a long time to build them back up. And some of that that's a complex situation, but a lot of it was, I really think, not being identified as autistic as a young adult or child, and also not getting that intervention and that support, going into the of independence as a young adult.
Right. And I think as parents, we have to be willing to kind of branch out and not just rely on the way we were raised and, how we were taught, because it's a new time. It's a new generation. We know more about these disorders. They're being identified and diagnosed, easier. We know that girls were really under-identified. They didn't fit that classic hyperactive little boy running around in the classroom. It can really manifest itself in more of that executive function domain. Sometimes my niece actually has ADHD, and I'm like, I know you're looking at me, but I know you have no clue about what I'm saying.
No idea. That's another thing we do that's in each other, like, without any kind of blaming or shaming, just saying, did you hear what I said? Or should I say it again? Because, even my adult partner will answer, like, yeah, I heard you. But if you ask him to repeat it back, he didn't hear you. And it's not like he's trying to ignore
Right.
you. It's
Right.
his brain was doing something else. And it can really help my daughter out to say, can you repeat what I said just so I can check? And then she knows if she actually heard it or not. So it helps her identify what her brain is doing and come up with her own ways to, like, you know, accommodate that.
Mm-hmm.
So, yeah. Yeah.
Right. You know, my little boy, I literally buy, he has about 3 pairs of sneakers
Mm-hmm.
because I know every morning we will not find one pair. We might find like one pair each.
Mm-hmm.
And did I say that right? I don't think I said that right. But one shoe of each pair each, but we never get a matching pair. And it's so easy as I'm rushing in the morning to get frustrated, you know? And I'm like, we literally live 5 minutes from the school and we still are late.
Yeah. Yeah. What I always try to remember is like, kids are slower than adults because they're still learning. And kids with executive dysfunction or other kind of challenges can be even slower. But we have to be on the same team as our kids.
Yes.
Like you were saying, when we were growing up, I think a lot of the way our parents were raising us was this hierarchy where you just do what your parents say and that's it. And I just, research-wise, evidence-wise, that's not the best. That doesn't get you the best result for a healthy child or to become a healthy adult, a psychologically healthy adult. But a collaborative method where we're on the same team as our kids, we are both supporting the other, can really help you, or at least it helped me. I shouldn't speak for everyone, but it helped me a lot with that day frustration of we're late to school, I didn't get to the grocery store, and now we won't have dinner or whatever. Because there's always, it's like, okay, I didn't make dinner today because I couldn't get to the grocery store, but I figured out a really important thing about why my kid doesn't like to wear socks. And that's going to help me for the next year, whereas, ordering pizza tonight is not really a big deal. So sometimes it feels like, as a parent that you have this idea of your priorities and what you should try to make happen today. But if your kid needs something different, sometimes the right thing to do as a parent is to throw your priorities out just for the day and focus on, what's going on. I'm picking the socks because my daughter didn't wear socks for like 6 months straight because she has, and it took us forever to figure out like what exactly was the problem. So now she can wear socks again. But it was like a lot of work just to figure out socks. And I think if a function, like a neuro person, you're really tempted to just be like, well, that's a really kind of a waste of that I spend time and energy figuring out this little problem. But if you do that repeatedly, you build trust with your child that you're going to hear them when they have a problem and they're going to come to you with bigger problems. And also you build problem solving. So like she hears me work with her on how we solve the sock issue. And now I hear her with her brother sometimes being like, well, we tried this and this didn't work. What if we did this instead? And they're 6 and 8. So like the fact that they can kind of have these pretty complex conversations between each other where they're listening to each other, they're thinking about the other's feelings at the, at age level that they can, they're problem solving together. That's a collaborative approach. And that's going to help them when they go to work, when they go to school, when they're participating in human life. We're a collaborative social species.
Well, so that's a part of the treatment and intervention too, is living it every day and parents leading by example. And you're right, because I have a 20-year-old, an 18-year-old, and a 10-year-old. And I will hear my adult children talk to their younger brother and will say, you know what? It's not a big deal. Everybody's brain works differently. And more of that acceptance. Now, I'm going to be honest with you. Like in the beginning, there was a learning curve. And definitely I probably said things to shame and lower their self-esteem. I mean, I'm just going to be really real by it. It took a concerted effort as a mom. And even though I was in healthcare, I was a nurse for 30 years. This is not my specialty. This is not my training, right? And I needed to seek help. I needed to create a team of people to help me, to teach me, and then I can also help my son. And what that has done is that I see him out on the playground, and when there's difficulties, he will use words like, you know what, I think we need a break. Or, you know what, I think I need some space. I still very much like you, but I just need some space. So they start repeating what you say. And that really helps them develop those skills in the relationship, because they also know that they have their, you know, there's some unique needs here, right? And I never want my children to feel that shame, because the only shame within all of this is the shame itself. There's nothing shameful for kind of thinking a different way, or you know, having any kind of disability. There should be no shame.
Absolutely agree. I mean, and as an autistic adult, I think you're always fighting stereotypes about what autism means. For example, like people look at me and like, you know, you're not a young kid, you're an adult, you have a family, you have a job, like clearly you're not autistic. And it's like, you know, the stereotypes can be so narrow that they exclude a lot of us, and people don't see us. You know, we're not, I can't think of the word I mean, but we're not validated for who we are.
Yeah.
And I just hate to think of that, especially with my son is like a little white boy. So he, to some degree, fits the stereotype, for better or worse. My daughter has a lot of ADHD traits. And I think anyone who's familiar with ADHD would, you know, point to her right away. But she's also like a young child, and she's not the traditional face of ADHD. And a lot of people push her to be quieter, be kinder, be small, use a quieter voice, you know, all that kind of traditional stuff you tell little girls. And I hate it, because it's not her personality. And if she were a boy, she wouldn't get that. And so it's like, there's so many nuances to how the stereotypes affect us. I don't want her to be ashamed because she's a little louder and a little bouncier than whatever we tell young girls they should be. And I don't want my son to be ashamed because, you know, he's that he's a little bit more struck by his routine, or his eating is narrower, or any kind of thing. Because they can still contribute. Like, I think there's lots of people like me who do contribute to society in lots of different ways. And we are very valuable and can do things that, you know, some neurotypical people can't. There need to be all kinds in society. And I want my kids to know that they are valid for who they are, and they are unique for who they are, and they can grow up and contribute. And there should be zero shame in any of that.
Right. So sorry, there's a little lapse in the video, so sometimes I don't mean to interrupt you, but that could also be my ADHD, to be honest. Because I do that to people.
I'm that too. I'm from New Jersey. I just keep talking, so don't worry.
Well, I'm from New York, so we're kind of like in the same neighborhood.
Yeah, we're fine.
So you were talking a little bit about like OT, and can you talk a little bit about like resources and possibly like what that team looks like to help parents navigate these uncharted waters?
Yeah. So for us, we had our occupational therapist on board basically from day one. And we actually ended up getting the same lady for both my son and my daughter. And she was fantastic. If you're not happy with your OT, or you feel like OT is not helping, try to find another therapist, because sometimes it's just the therapist is not the best fit for your family. Excuse me. But she did such a great job in breaking down kind of exactly what especially sensory processing issues look like in ADHD and autistic brains, and in kind of nailing down what are some day-to-day things we can do to break kind of negative cycles and reduce tantruming or overwhelm kind of, they look like tantrums, but they're not meltdowns. That's the word I mean. So occupational therapy is like my go-to recommendation.
Mm-hmm.
I also did speech therapy for my son who had some hearing loss when he was younger and has kind of a little bit of a unique way of speaking, but I think a lot of autistic kids have some kinds of speech challenges sometimes. And speech is also really great for social emotional intelligence support.
Yes.
So,
yes.
Yeah. So a lot of speech therapists will even do groups for neurodivergent kids where you can, like, to teach your kid what it means when someone's face does this.
Mm-hmm. Mm-hmm.
And what I just say about that is
like emotional regulation piece.
That's really important. Yeah. And OTs can support that, I will say. So the speech OT combo can be really solid. I will just, with those social groups, to just watch out that this is from my autistic perspective. So, people can have different perspectives. But for me, what I always get nervous about is when there is an assumption in those groups that the autistic way of communicating is inherently flawed. And then the neurotypical way of communicating is like the best way. I think ideally we're teaching neurotypical people how to communicate with neurodivergent people and vice versa, right? That it doesn't just go one way, that we have to be like you guys, but that, you learn how to read us too. So things like forcing eye contact, even if the child is uncomfortable, or things like, any kind of like, you can teach a norm without forcing a child to do it all the time. And that's the thing that makes me just, personally as an autism advocate, very uncomfortable, and it can damage autistic kids. So yeah, I just wanted to put my 2 cents in.
Yeah, like as with that, and it's not necessarily that way. That's what I'm hearing you say. It's not that we have to communicate like them, but we have to mutually be able to understand each other. And really, when I was teaching effective communication in nursing school, nobody knows how to communicate, okay? And that's one of the reasons why there's so many healthcare injuries, is because even doctors and nurses, even if they follow the template, they don't know how to communicate to get the message across. So your way is wrong, and you have to be like me. It's really understanding and mutually respecting the differences. Is that what I'm hearing from you?
Sorry,
I think you're frozen a little bit.
Oh, well, now I can hear you. So maybe we're just behind each other a little bit. I'll wait to see if you can hear me.
Yes, I can hear you.
Okay, good. We caught up to each other. I heard all of that. I think there was a lag. So yeah, and I completely agree. I think thinking about it in terms of cultural competency can be really helpful, that there's not one culture that's better than another, right? That everybody's a little bit different and back to different things, but they're all useful and valuable and valid. And it's the same with communication styles, that just because your autistic kiddo communicates in a certain way, it doesn't mean that he needs to change what he's doing and communicate in the neurotypical way. We just want both sides to be understanding each other and, figure out what the other side means. So you go to couples counseling, you expect both of you to change a little bit, right? Not just one person conforming to the other.
Right. Because that's not going to work, right? I mean, it needs to be equitable, right? So let me ask you a little bit about your podcast. Like,
sure.
What made you want to do it? It took a lot of courage. I mean, when my team came to me and said, I think we should do Instagram lives, and you need to do it, I was like, oh my word. I was so nervous to get out there and be live and organic, and it can be a little intimidating. So somebody that is on the spectrum, how do you handle that type of anxiety? And what made you kind of want to come forward?
I think, so my son was diagnosed before I was identified. And as part of that process of self-identifying and then officially getting identified and also learning for him and my daughter, I did so much research
Mm-hmm.
and was really unhappy, honestly, with the quality there for parents with newly identified children with either ADHD or autism or other forms of neurodivergence. A lot of the information, a lot of the things parents are told to do and things that parents are told will help their children are not evidence-based, are based in faulty science or outdated, a lot of outdated work. They're ableist. They don't support, like they don't have a human rights basis. And a lot of the articles I was reading on popular news sites and blogs were really making it out to be like all ADHD and all autism is terrible, and you are, your parent, you have to say goodbye to the child you thought you have, and lean into this new terrible life where your children never do what they want you to do. And I'm exaggerating slightly, but only slightly. Like a lot of the literature that new parents or newly identified folks are exposed to is really horrifyingly pessimistic and not realistic, because although there are folks with very severe disabilities who need a lot of support, they can still contribute to the world. And so can a lot of us who are identified with ADHD, but don't have as high support needs. And a lot of us do have high support needs, but still function fine in other areas. There's a wide diversity in autism and ADHD folks. So anyway, after a while of kind of ingesting all this stuff, I think I just hit a breaking point of feeling like, oh, and the other thing is I started going to a support group for parents of autistic children. This was before COVID, when you can still see people in real life. And all of the parents there, I believe they were all neurotypical to my knowledge. They all had autistic kiddos. They were all such good, well-intentioned, clearly cared deeply about their kiddos and were trying to make the best decisions. And they had all of this terrible information, like really, because the stuff their doctors were handing them and their assessment teams were handing them, and even sometimes their providers, like their speech and therapy providers were handing them, was all like, your autistic kid is never going to be able to contribute to the world kind of rhetoric stuff. And I think I just hit this point where I was like, this is junk. Like, this is not realistic. It's not helping parents. It's harming children who are now being told that they can't ever do things because you have. And I think my kind of fed upness just overcame any kind of anxiety or stress I could have about just putting stuff out there, because I'm not a professional team. I'm one person. I occasionally have a friend who proofreads posts with me, but like, this is not like the highly professional podcast, but it does come from a place of, we're trying to be evidence-based, look at the research, and using some of my life coaching background and the reading I've done and my own experience raising kids, and say, what would I have wanted to be told and to know when I was first identified or my kids were first identified? If I could Google, what would I want to see at the top of the list of the page of, how to help an autistic child or whatever? Because what's there right now, I'm sure it's well-intentioned, but a lot of it is not helpful, but harmful. A lot of my work is just trying to do my best to put stuff out and hope it reaches the ears of people who need that information and can't find it in other places. And
so a lot of misinformation, and I think most parents it's really hard for them to decipher what is truth. And I remember I also did some advocacy on the IEP level, and parents being told the first time that there's some issues. And it's almost like it's expected to have this devastating reaction.
Yeah.
And I'm like, wait a minute, this is not devastating. This is a wonderful thing that we're able to identify how we can help this child and give him the support that he needs, because there's so many people out there that are navigating society and they're struggling because they haven't been identified.
Exactly.
And I think it's really what I noticed. I used to work a lot with TACA, the organization for autism, and do a lot of research with biomedical intervention for children that struggled with these types of disorders, and on a functional medicine type realm. And what I've noticed is that the parents that were able to be okay and to find the solution and treatment, and also sometimes it doesn't need to be treated. Being different is not like we need a prescription. Okay. And everybody is different. So does everybody need a prescription? Like, this doesn't actually have to always be a problem. Everything doesn't always have to be a problem. And so the parents that identified the passions with those kids did really well. Yeah. If you identify what they're interested in and what their passion is, and you nurture that, a lot of these kids thrived.
Absolutely.
And a lot of them go into engineering or physics or math, and and they thrive. They do very well in life. Yeah. So I think the way we react as parents and our perception, you're right, it needs to shift.
Yeah. Yeah. And I think a lot of parents just don't have access to information that would help them. Like, they don't know anything about autism before they go in the room, and some medical provider says, we think it's autism, we want to do this assessment. And if you have no information, you can't make an informed choice about how you're going to go into that and how you're going to portray that for your kid and for your family. So part of what I want to do is just get the information out there that there's a huge range of diversity within autistic folks and ADHD folks and other neurodivergent folks. And the stereotype that you got from TV and from comic books and whatever is not the only way to be autistic or ADHD. And like you said, many of us, every individual on the planet, regardless of your neurotype, probably has some support needs of some kind. And there's no particular reason to label someone who needs support needs as different from somebody who doesn't. It just means, it means very little, I guess, is basically what I'd say. Right. So yeah, the identification should be about helping the child and not really about stereotyping them to live with a disease or a disorder. I'm not a fan of the medicalization language, but it's helpful for diagnosis. But, at that point, it's like, well, what does disorder mean? It just means your brain is a little different. But you, like you said, you're any kind of child, you're going to be trying to support their learning and their skill development. And autistic and ADHD kids have the same interest in skill development. Like, if you let them do the thing they're interested in doing and hyper-focus on that special interest, they're going to develop resilience and grit and determination and all those things we want for all kids, from engaging with the hyper-focus. The same way a neurotypical kid might from kind of ranging in what they're doing. So there's all sorts of ways. You don't have to do it.
I have, my daughter actually has auditory processing. She has some learning disabilities. And, she started to be told when we were getting the intervention, like, you can't do this, you can't do that, you need this, you need that. And I'm like, oh no, like, let's just stop there. Yeah. Okay. We know that she needs supports. And we know that we have to advocate for that. But we don't want to like take on the diagnosis and that's who we are. Yeah. My daughter is not her diagnosis, right? Yeah. It's a part of who like she is, and she needs some supports. And when she goes, in college, she gets, her assistive technology that helps her take notes, but it doesn't take away from the rest of the package. And it doesn't have to lead to like and this might be a little controversial, but this like victim mentality.
Yeah. Yeah. I think that, you know, we can agree that there are some folks who have very severe disabilities who need a lot of support, and it can be easy to fall into this and, you know, this kind of trap of feeling like you can't enact anything for yourself. You don't have any agency on your own. And as it can be really hard. But I feel like there's even a child who doesn't speak, or a child who can't use their, or what am I trying to say? Anybody who's severely disabled can still be a part, like they're still a part of the human family. They're still
Right.
a part of the social, you know, our society and our towns and they can still engage with us and bring something to their world. And
Right.
I think anytime that you try to say, well, because of your diagnosis, you're not like human enough to be with us, that's really, you know, that's when I
Right.
start to, and I feel like that's what a lot of parents are getting, unfortunately, first time when they come back with that identification for their child is they're hearing, well, if you're autistic, you can't be part of human society, of our world the way it is. And I think we need to work to kind of expand our notion of what our human family is and what being human means, that we have all these different kinds of humans, right? And in our current world, it's harder to live as some kind of people versus other kinds of people, right? That applies to all
So
sorts of
let me
disabilities.
ask you,
Yeah.
you know, we've come so far in research, right? And we've come so far in being able to identify much sooner those that may need intervention. There's programs, you know, state, federal programs for early intervention. Pediatricians are definitely more aware than they were 30 years ago. So do you think that that's shifting with all this awareness, you know, various advocacy programs such as yours? Do you see that shifting? Do you see it shifting in the public schools? Do you see that shifting amongst professionals? What do you see?
So what the research is telling us, as far as I am aware right now, is that white people and people of higher financial means are more aware of what autism and ADHD are, more likely to be able to identify it in their kids, and more likely to accept support from school or public organizations when their kid is identified. Black and Hispanic families and lower income families in the this is just for the United States, I don't know the stats. So Black and Hispanic families in the United States and lower income families still have, and this is very complicated, but basically don't have enough access to good identification, don't have enough access to good schooling, don't have a good. So a lot of it is more about access than the families themselves. So I hope that we can get more, you know, Black and Hispanic folks trained as professionals to go into their communities and identify. A lot of Black and Hispanic folks rightly don't trust, you know, white doctors. A lot of them have experience with their kids being over medicated, so diagnosed for ADHD, and they're just given pills as opposed to behavioral support or other kinds of support, which any good doctor should offer before offering pills,
Right.
but that's not what Black folks see. So yeah, I think there's a big range in ways that we still need to improve as a community in terms of supporting those families. It is better than it was. I mean, you know, just when, up until right before I was a kid, autistic people who had kind of outward display of traits and weren't masking well were still in institutions, right?
Yeah.
Like,
Yeah.
so, you know, when I was a kid, we you know, there was at least integrated schooling. Kids nowadays, at least in my like upper middle class white school district, understand what autism is and understand what ADHD is, and they all have. Schools have made really great progress, especially the schools with enough funding to have a lot of social emotional support in the classroom,
Yeah.
and a lot of
Yeah.
training programs on social emotional support. So autistic kids are not going to fall as far behind on that because it's in their class and it's being applied to the whole student body.
Yeah.
So yeah, it's a mixed bag. Like it is getting better in a lot of ways, but there's still a long way to go for a lot of kids.
Well, and we even see that on the IEP level, right? When Hispanic or African American families try to advocate for their children within the school system, and really not being heard and respected. So it's kind of like across the board. There are organizations I know here in California called Parents Helping Parents, and they're an advocacy group to help parents advocate for their kids. Because let me tell you, as a parent, as a mom, you know when your kid is struggling, you know when something is not right. And using the pediatrician as the foundation of seeking care, they're kind of, I call them like the ultimate, medical managers, being able to refer out, and, insurance will pay for private evaluations if needed. And at university hospitals that accept Medi-Cal or Medicaid, you can get on the waiting list to get that neuropsych evaluation or a speech and language evaluation for your child. But I think that these are the resources that most parents are not aware of. And also, if you